last 15 years as a physiotherapist, and I'll try to tell you today what other people will not tell you. Like your orthopedic surgeon may not tell you, your GP may not tell you, and your physiotherapist in NHS might try to tell you, explain you, but some patients don't necessarily believe or have the confidence in physiotherapist as much as they should and can have. So that's the biggest problem. So let's start with this phrase. I find it very interesting and useful. So it's by Einstein. We cannot solve our problems with the same thinking we used when we created them. I'll just add one word to the thinking: knowledge or information. So obviously all of us know information is power. Okay? That's why you are here, to get some information. So hopefully at the end of session you will have more power, more information to make right decision about your knee pain or your family and friends suffering with knee pain. And that's why I think all of us need new knowledge, new power, new information all the time to take the right step to solve the problem we created or we suffer without our invitation to problem. I'm sure we don't invite problems, but they do come without invitations. So in the talk today, I'm covering chronic knee pain, which means somebody who's got pain for longer than 3 months. Okay? So these all things you read on the screen are not covered. I'm not directly talking about them. Although a lot of things I will say will apply to the problems you see on the screen, which is acute knee pain, pain less than 3 months old. Okay, let's have a raise of hand, show of hands. How many of you have knee pain? Good. And how many of you have pain in the knee for more than 3 months? Okay. And I'm sure all of you are working, going to restaurants, sarsas, having meals. Your life is not stopped by the knee pain. You're not housebound or bedbound or wheelchair bound due to the knee pain. Okay. So the information with chronic information today will be certainly relevant to most of you. Acute knee pain, which means pain from an injury or pain which came suddenly and is less than 3 months old, is not directly kind of covered by me today, but I can answer the questions if you have any on that. Ligament injuries, rheumatoid arthritis is a total different ball game. Rheumatoid arthritis is complicated, is less common. Fortunately, I can say confidently, rheumatoid arthritis is less common, so you don't need to worry about that, but you can ask me questions if you have any on that. And pain in children who are under 18, obviously, and all these problems need specialist, GP, physiotherapist, medications, blood test, scan, x-ray at different times depending on different phase and so on. So I'm not covering these, but we can discuss this later if you want to. So how many of you seen an orthopedic surgeon or specialist for your knee pain? Okay, good. Anybody who already had a surgery? Any keyhole surgery, operation on the knee? Okay, 2 hands, keyhole surgeries, 2 hands. Anybody who's been told they need a knee replacement operation? You've been told knee replacement operation. Okay. Partially, half of the knee. Okay. Yeah, so we'll touch upon that as well. What's the role of knee keyhole surgery and what should you expect after knee replacement if somebody of you are going to have it? Maybe your elderly parents might be told that they need it, which they can't come here obviously for some reason. So this information might help you. All of you must have thought sometime or the other, why does it take long to get rid of knee pain? Or you must have asked yourself, told yourself the knee pain doesn't go ever without a surgery or an operation. So there are certainly some causes for it, some reasons for it. So these are the possible causes in different cases. Okay, delayed diagnosis, delayed start of treatment, inaccurate diagnosis, which could be a mistake of a physiotherapist or a surgeon, because they do make mistakes. They are not gods; they are human beings too. Inaccurate choice of exercise by patient or physiotherapist. Many patients coming to me tell me that since this pain came, I started doing this. but I feel a little bit better, or I'm worse, I need your advice on what to do. And sometimes physiotherapists get the exercises wrong as well. So what I am doing for my patients now is different as compared to what I did 15 years ago. Okay, so because I learned a lot and read a lot and thought a lot, and I met thousands of patients with knee pain. So patients taught me a lot as well from their stories. Sometimes it's lack of patient compliance, or to be rude or undiplomatic, laziness of the patient or physiotherapist. Insufficient dose or repetition of exercises. Okay, so I'm sure you want to know how much is minimum required exercise, or so that I feel better long term. I'm not talking about short term. You might feel better with short term treatment, like you might feel better for a week or two, a day or two with whatever you have done so far. But I'm talking about long term improvement in knee pain, how to achieve it. Okay, not talking about short term gain like an osteopath or chiropractor might promise you. Sometimes they are really good, sometimes not so good. So, and lack of belief by patient in diagnosis and treatment. Now this is the biggest one. It's at the bottom, but it's really very important. If the patient doesn't believe the doctor or surgeon or physiotherapist in the diagnosis or the treatment they have offered to the patient, they will never be satisfied, or they will never get the improvement they need. Because we have to have confidence and belief in faith in the person we are seeing. That's the bottom line. And obviously sometimes you won't decide to see someone else because you don't trust the first person you see. Right, and the most common, and I think is a relevant one, in the beginning, when the knee pain starts without an injury, okay, when there is a pain which doesn't come from an injury, most of us decide to rest it. And I like this phrase, I love it. Our national treatment for every disease is so jao thodi der. Okay? It's not applicable to just Indians, I would say, or country of origin doesn't matter. All are human beings. Okay? Many white patients I see in my practice, they tell me, I started having this pain, so I decided to rest it. Obviously, they're not sleeping 24/7, but that's what the phrase implies. Rest it, or just sleep it off, which is not right. I would say if you approach a GP or physiotherapist in the first 6 months of having the knee pain felt first time in life, you can get rid of knee pain. Okay, patients delay it. They do the national treatment, so jao thodi der, for sometimes in the beginning. Then the doctor thinks, oh, it's the first time you have it, so I'll give you some painkillers. Try them for 4 weeks, and if it doesn't go, come back to me. Another problem, I think, is a bigger problem, is patients are confused. And my biggest worry is patients don't know they are confused. Okay, I'll justify why I say that. I am saying that because, you know, when you go to the doctor with a knee pain, which didn't start with a major injury or accident or fracture, you expect the doctor to say the same thing I said. Take these painkillers or tablets, rest it, come back to me if it doesn't go away. Most of you don't want to take tablets because of the side effects. 95% of my patients tell me, I don't like tablets, I'm not a tablet person. And they either rest it out or look for something else, like an oil or an ointment or some herbal remedies. Some people also try homeopathy, etc. So because the patients are confused and they don't know they are confused, the knee pain you can't get rid of the knee pain. Second thing is, if you're waiting for a physiotherapist appointment, it takes 4 weeks or 6 weeks for you to see the physio in the first place. They look at you, talk to you, and unfortunately they are asked to spend a lot of time on writing the notes. Okay, they are under huge pressure. I have sympathy for my NHS physio colleagues because they get 45 minutes or half an hour to see the patient at the first appointment, and a lot of time they are forced to spend on is writing notes. That means they can't spend enough time with patient looking at the body and the knee and teaching them, supervising them the exercises. They just make sure there's no fracture, the patient doesn't need to go to casualty A&E, doesn't need an operation now, and then they explain you that it's possibly osteoarthritis or mechanical knee pain or wear and tear, you might have heard, and then the process of exercise treatment starts. But because of many reasons and pressures, and some reasons are caused by patients, some are caused by the system and the physio, there is lack of satisfaction. Before I came to this country, I was thinking that NHS or health service in this country may be perfect, excellent. But after working here for more than 8.5 years, I am slightly disappointed. It's available, you can have a service, you get to see GP, physiotherapist, orthopedic surgeon, you get to see them. But the delay, the waiting time, and the content of treatment and everything leads to a dissatisfaction. And the dissatisfaction is what worries me more, because I know physiotherapy has got huge potential. Exercise has got huge potential. You are doing yoga because you know it's good for your health. I'm sure you want to know more, and that's why you're here. Okay. Now coming back to the specific diagnosis of knee pain can be made with just what the patient tells the doctor or the physio. So you don't have to assume that you must get an X-ray or MRI scan for finding out what's wrong with my knee. That's the bottom line. If some patients strongly believe they must have an X-ray or a scan to confirm what's going on inside my knee, that's not right in 90% of the cases. Okay, so if you don't get given an X-ray for a pain which is less than 6 months old, less than 1 year old, don't worry. Okay, and I'm talking about people who are going to work, who can sleep without pain. Okay, who wake up with maybe a little bit of pain, but they go to work with some painkillers or without painkillers, and those are the people who will get harm from X-ray rather than benefit from X-ray. So don't assume the doctor must do an X-ray or the surgeon must do an X-ray. X-rays are reserved for some reason, and they should not be used for every single patient. Okay? In fact, good doctors don't repeat an X-ray in less than 6 months. They would repeat an X-ray after 6 months if they think you should need a surgery, not before that, not without that. Now, the detailed physical examination by physio is really important. Okay. Now, the knee is not just the knee. You need to remember there is a hip joint above, which is here, and an ankle and foot below the knee, and the knee is a sandwich between the two, or kind of sandwich between the long leg. So problems going on in the hip can cause knee pain, problems going on in the foot, ankle can cause knee pain, and because it hurts in the knee, patient almost always assumes something is wrong inside my knee only. That's where the problem starts, not actually finishes. That's where the problem starts. So you need to remember the leg is a unit. Okay, it's connected to hip and ankle. Many times people have more problem in the hip or ankle and foot, and that causes the knee pain, not the knee itself. That's a very basic general idea I'm giving you. And history, which means what you tell the patient or tell the physio doctor, is enough. And in 10% cases, when the swelling is there, the skin is hot, shiny, red, stretched on the joint. Okay, the skin over the knee joint is red, hot, shiny. I'll show you pictures. If the skin over the knee joint is shiny, hot, red, that may warrant an MRI scan, okay, or at least an X-ray. But in that scenario, MRI is better than X-ray. Okay. Again, I can't talk about treatment without talking about the cause of pain. Okay. I know this is too much for you. I know you don't need this. You don't want this information. You are here to know. Tell me मैं क्या करूँ, how do I get better, tell me मुझे कैसे फायदा होगा, don't tell me theory or books. Okay, I understand that, but if you don't know the cause of your pain and I just tell you basic exercises and that you apply it wrongly to yourself or your family, you will lose faith in me, or you will lose faith in the knowledge of a physiotherapist. That's why I'm covering this. Okay, so there are two basic reasons for pain: mechanical pain, inflammatory pain. Okay, inflammatory pain is very less common, which means gout, rheumatoid arthritis, psoriatic arthritis, septic arthritis. Okay, rheumatoid arthritis affects 1% of the population, but osteoarthritis or mechanical knee pain, I can say with confidence, with every household has got at least one member with this pain, osteoarthritis pain or mechanical knee pain. It doesn't matter the age. They can be 20-year-old, they can be 80-year-old or 60-year-old. So osteoarthritis or mechanical knee pain happens in every household, every family. But the other ones you see on the right side, they happen to 1% of population. And I'll help you to understand the difference between the two and when to think of the worst one. Obviously the right ones, you need more of, okay. If you have pain and swelling and stiffness in the morning for more than 45 minutes in the knee, then it could be inflammatory arthritis, which is rheumatoid or gout, and then that's when physiotherapist has not a lot to offer. The doctor needs to start you on the right medication after the right blood test, and after a few months you will feel better, and then you may see a physiotherapist to make sure that the pain doesn't come back and your muscle strength which you lost in the process in the few weeks or months, you get it back. Okay? And generally it happens in the small hands and feet joints, and many joints are affected at the same time. Now I hear an interesting thing. Many patients come to me with pain in one knee, and I ask them, what do you think is the cause of pain? They say old age. If they are over 40 or nearly 40, most of them say it's old age. My question to all of them with pain in one knee is your one knee older than the other? So they need to think differently, and that's why I talk the way I talk. Okay, I'm trying to challenge your thinking at the same time. You need to ask more questions to yourself and sometimes the doctors, but unfortunately the doctors get only 10 minutes with you. So they're not interested, or they haven't got the time to actually answer all your questions. That's why people use sometimes Dr. Google, which is making her life harder. Okay, Dr. Google makes you more confused. So you need to maybe read more and think more about how and where it's hurting. In the mechanical pain, mornings are better, which means you might feel a bit stiffness in the joint. Okay, it may be hard to get out of bed or walk for the first few steps, but it doesn't last more than few minutes, and that's pain from osteoarthritis or mechanical problem in the knee or the whole leg. Okay, if you think, oh, it's hurting, it's a bit stiff, but you carry on, you do everything in the morning chores, and you go to work, and you then forget there was a pain in the morning when I got out of bed, and that is a mechanical pain or osteoarthritis pain. Overnight rest can reduce it, or if you just rest for a few minutes, you can have relief from that pain. And generally it starts after a walking holiday, trekking, hiking, climbing, jumping, which we call as misuse, overuse or new use. If you've done something new, something extra your body is not used to, and your joint is taken more pressure, prolonged pressure, it will hurt, it will cause you pain, and that is mechanical pain. And the person with mechanical pain can live for years without having to take medication, or with small amount of medication here and there, once a week or twice a week. And I'm sure most of you don't like taking tablets because you're worried about side effects anyway. Don't be worried about side effects.